All right, today we're going to talk about the surgical procedure of total knee replacement or total knee arthroplasty. This is a procedure to treat patients who have end-stage and severe arthritis of the knee. If you look at this left knee, you can see that the cartilage space between the thigh bone, which is the femur, and the leg bone, the tibia, is completely lost. There's no space essentially left in between the inside portion of the knee and the outside portion of the knee, and then when this patient walks, there's bone-on-bone articulation, which causes severe debilitating pain. If we look at the right knee, you can see that there is still some space left on both sides, and this side is not nearly as symptomatic as the left, which is requiring surgery to fix the pathology of this severe arthritis in this patient. In this patient with severe arthritis, often after failure of conservative treatment, surgical intervention with a knee replacement or knee arthroplasty is recommended to help control pain and restore function. This model will demonstrate what a total knee replacement surgery involves. This is placing a metal cap on the thigh bone, a metal cap on the leg bone, and in between these two metal caps is a thick piece of plastic. This piece of plastic acts as the joint and acts as a smooth articulation between the thigh bone and the leg bone, so when the patient walks, the pain is alleviated because prior to the surgery there was no cartilage space left and there was bone-on-bone contact, which typically gives severe pain. The surgery takes about 90 minutes. Patients typically in the hospital for 2 to 3 days. Often they can go home. Occasionally they may go to a rehab facility for a short period of time. There is extensive rehab after the surgery of several months, typically first at home for 1 to 2 weeks, and then often for several months in an outpatient setting to improve the range of motion, function, and help the patient walk. It does take time to recover and rehab from this surgical procedure, but outcomes are generally very successful in helping patients alleviate their pain and restore their function and mobility.